Dr. John Kennedy's work as a cardiologist has helped shape his respect for the powerful impact of stress on our hearts and has inspired him to create the Breathe technique, the perfect stress management tool that's easy to learn. Drawing on a huge body of evidence, Dr. Kennedy's speech, Managing Stress in the Workplace, has helped thousands of people across the nation. Although a proponent of modern high-tech medicine, which he incorporates in his daily practice, Dr. Kennedy is also a firm believer in preventative cardiology and feels we can no longer afford to ignore relaxation therapy as an important adjunct for battling heart disease. Dr. Kennedy has been featured in the Discovery Channel program Life or Death and has worked as a medical advisor for the ABC series Vital Signs.
Along with being a cardiologist and American Heart Association board member, he also just published the 15-minute Heart Cure, all about reducing stress and healing your heart.
When we get stressed, we release stress hormones, adrenaline and cortisol, and both of which increase our heart rate, increase our blood pressure, and make us feel jittery. So when we get stressed, it definitely affects our sleep.
Are there any techniques that you can use so that you can de-stress before you try and close those eyes?
Yeah, the simplest thing is breathing. And when you take a deep breath in, our heart rate actually increases a little bit. And when we exhale, our heart rate decreases. And as you exhale, try to emphasize exhalation because that stimulates the opposite of the stress response and calms us.
Walter Cannon, this famous physiologist, epidemiologist from Harvard, who was studying this voodoo witch doctor in Australia. And there were multiple case reports of these people that were dying suddenly after this voodoo witch doctor would point this bone, this animal bone at people. And I don't want to point at you guys. I don't want anybody dropping. He would point this bone and he would curse them to death. And they, lo and behold, 24, 48 hours later, they would die. And Walter Cannon looked at 4 or 5 of these reports and he said, this can't be true. I don't believe this whole mumbo jumbo voodoo stuff. There must be something about the belief in the idea that you're going to die that stimulates this massive hormonal response that leads to a sudden arrhythmia and people die. And he went on to say that this response, this fight or flight response, which is what he coined, was this really amazing body response to a life-threatening situation, which is so profound in some cases that it could even cause death. But it's also what he attributes our survival as a species to. The problem today is that as we race through life at breakneck speed, we're stimulating this same fight or flight response. And over time, we're trying to do more with less time, and we're triggering the same stress response when the saber-toothed tiger or somebody pointing a gun at us doesn't exist.
What makes what I talk about identifiable and very useful to people is the way I tell the story. It's presented in storytelling format. It's not, hey, I'm a doctor telling you a bunch of fancy multisyllabic words. It's here's my patient, and here's the story, and here's how the story unfolded, and here's how stress impacted their cardiovascular health. We've proven that stress, emotional stress, and we can measure it now, is an independent risk factor for heart disease. Just like high blood pressure, just like diabetes, just like smoking, and just like a family history of premature coronary disease. So we got to start recognizing that this is real. Data to support it include the data I just talked about at USC. USC showed they followed people over 10 years with known coronary disease, and they showed that if you're stressed, if you have high anxiety, you have a 4 to 5-fold increase of death or heart attack compared to those people that had low levels of stress and had an ability to find inner calm. The Breathe technique is a special relaxation technique that uses 2 proven forms of relaxation, guided imagery and breath work. And it combines them both, and it also incorporates in the word breathe. And breathing is what connects our heart and our brain, and it's what elicits this relaxation response, the opposite of the stress response.
Stress kind of comes in 2 varieties. It either comes in an acute variety, which is sort of like a flash flood. It strikes without warning. It's sort of like a road rage kind of thing. Or it comes in sort of a more indolent, sort of chronic day in, day out types of stress, like a tropical storm that might be brewing for a week or 2. And this is an example of chronic stress is work stress, or dealing with a dysfunctional or difficult chronic relationship. And in both cases, whether it's acute or chronic, whether it's anxiety, depression, anger, or hostility, the physiologic response internally is the same. You stimulate the sympathetic nervous system. There's lower heart rate variability, which we know is a predictor for cardiovascular mortality. When we relax, when we elicit the relaxation response, the equal and opposite of the stress response, we increase heart rate variability. When we take a deep breath in, our heart rate goes up, and as we exhale, our heart rate goes down. And this change in heart rate, this heart rate variability, is probably cardioprotective, and that parasympathetic tone that goes up when we elicit the relaxation response is probably a cardioprotective thing.
Companies understand that stress has a huge impact on the workplace. And I think companies that are progressive, that understand that a healthy workplace equals a healthy workforce, which equals a healthy business, get that stress management is an important part of that whole concept. And Breathe is the perfect technique for that equation. It's simple, everyone can use it, you can customize it to your stress in your workplace, and it's simple for people to understand and learn.
There's a lot of data now on work stress, and there's two specific types of stress they've looked at. One is the physical strain stress that we hear about a lot, workman's comp kind of stress, where you're having to do too much with too little time. And then there's also a type of stress they've looked at in the workplace where people feel socially isolated. They feel like they have no room for improvement. No one's acknowledging them as their work being important.
What I like about talking to people is teaching. And I think if you can explain something that's pretty complex in a simple way, and people can leave saying, wow, I learned a lot about the heart today, and they learned something that's really important in terms of protecting their heart down the road, that's the biggest reward that I can get.